Hello and welcome to the Sex Experts webinar series given by Center for Healthy Sex. My name is Kayna Cassard, and I'm one of the clinical associates here at Center for Healthy Sex. And today we're going to be talking about coping with female pelvic pain and difficulty reaching orgasm. Okay, so to get specific, what we're talking about to start is painful penetration, and this can occur in different ways. It can be diagnosed as vaginismus, as dyspareunia, or as vulvodynia, and oftentimes they're given different diagnoses by different health practitioners. So even gynecologists have different ways of diagnosing these issues, and so we'll go over it a little bit here in order to get a sense of exactly what it is that we're talking about. So vaginismus is the tightening of or the automatic spasm of the vaginal muscles, or the muscles basically that extend from the pelvic bone in the front, the pubic bone in the front to the tailbone in the back. And if you think about those muscles as like a hammock that stretches from those areas and sort of holds up all of the internal organs. Both men and women have these muscles, but in women specifically, when those muscles automatically tense up, it's called vaginismus, and that can lead to painful experiences either in the muscles or in the skin tissue in the vaginal area. The next one that I had mentioned is dyspareunia, and the technical definition of this is pain during intercourse. And this can be expanded to any sort of sexual intercourse, whether that's with using sex toys or whether that's using having penile-vaginal penetration. And then vulvodynia is another term that refers to pain in the vulvar area. And again, this can be as a result of gynecological exams, tampon insertion, and sex as well. Then anorgasmia is the inability to orgasm or its difficulty reaching orgasm. This can be specific to a situation or it can be generalized, so that and that means that a woman can't orgasm, or it could be that sometimes she doesn't orgasm. This also affects males too, but for today's talk we'll be talking about just female anorgasmia. The causes of these issues can be quite large. They could be And it could be very difficult to identify specifically what the causes are. Sometimes the cause could have happened years and years prior, and the woman didn't realize that it was a cause of it, and then suddenly she's starting to feel the effects. And so this could be, for instance, a psychological concern or trauma, or it might have been chronic yeast infections, or it could have been childbirth and then there's scar tissue left over in the vulvar area. So trying to identify the specific cause can actually be quite helpful in directing the treatment, but it's not completely necessary in order to obtain treatment for any of these issues. And the same thing goes for anorgasmia. The cause could be a little bit abstract because it might be something as simple as, or as difficult and complex as the way a woman was brought up in her childhood and the messages she received about sex or sexuality. Or it could be a worry or concern about her body image and how she carries herself sexually. And so it's important to start to address these concerns and these issues through therapy or with a trusted friend or professional to try and figure out what exactly is going on and why the woman is having difficulty with this. Let's see. So a lot of people ask me what the treatment is for it, and unfortunately it's not a very simple answer. And I recommend, and there's a lot of empirical evidence or research that shows that having a multidisciplinary team, meaning having people who can be on board on all different aspects of the woman's treatment. So this usually involves, but isn't limited to, those listed on your screen, if you can see that. So we have a medical doctor, specifically a gynecologist, who is familiar with pelvic pain issues, a physical therapist or a pelvic floor therapist, again, somebody who knows a lot about pelvic floor issues and pelvic pain issues, and then a psychotherapist to address the psychological components of having any of these diagnoses. And then another one that I think is extremely helpful is having an acupuncturist on board. So a medical doctor or gynecologist who has awareness of it is really essential for basically being able to rule out any sort of medical conditions that might be causing the pain or the anorgasmia. So if there's an organic or a medical or physical condition that's occurring, and if that can be addressed and taken care of, then the pain might go away on its own as a result of taking care of these issues. Or the doctor might need to be on board with the treatment in order to supplement the work that's done with a pelvic floor therapist, for instance, or a psychotherapist or an acupuncturist. Also, the medical doctor, I believe, needs to have good knowledge of the most recent information about pelvic pain, because a lot of gynecologists I've heard of saying to women that I've treated that they just need more lubrication or they need to relax more. And while those things might be helpful, it's not actually addressing a lot of the more complicated issues. So making sure that when talking to a doctor about these issues to really ask them what their experience is and knowledge is of vulvodynia, vaginismus. Our center has a lot of really wonderful referrals that we know of that give really excellent, thorough examinations and know what it is to look for when women are having sexual functioning issues. The next practitioner that I think is extremely important to get on board is a physical therapist or a pelvic floor therapist, again, somebody who has knowledge of pelvic pain issues and anorgasmia issues. The vaginal exam, the tightness or the structure of the muscles and trying to figure out exactly where the muscle structure is problematic for the woman. And this is wonderfully done because they can also take into consideration muscle issues in the back and hips or the legs as well as the vaginal muscles and be able to address and target each one of those so that the woman can have a specific case-by-case example and knowledge of what she needs to be able to do in order to address her body in particular. And the physical therapist can also teach hands-on how to do a proper Kegel exercise, for instance. And a Kegel exercise is basically where men or women can do this, but basically tightening up those vaginal muscles or those genital muscles in order to create nice muscle tension, but also to learn and create more awareness around muscle tension so that she can be in touch with how tense her muscles are and learn how to relax them and how to sort of get the muscles working in a way that works with her body. So a pelvic floor therapist or physical therapist can be extremely helpful in doing this. A psychotherapist will be able to address the psychological components of what's going on. So a lot of women experience depression or anxiety and relationship issues, communication issues, and being able to figure out how to function in relationship as well as within herself on working through the psychological effects of what she is experiencing as a result of this decline in sex life, this decline in relationship, potentially with the other partner, because it certainly affects the partner. And I'll get into it a little bit more of how to work on those issues with your therapist or as a therapist with your clients. And then as far as the acupuncture goes, that can be extremely beneficial in working through nerves and the muscles to release the energy and to create more blood flow. Okay. Again, I welcome your questions. Go ahead and type them in if you're joining us online, and I'm happy, again, to address whatever I'm able to. So in regards to psychotherapy, a lot of people, when they ask me about what's going on with their their sexual pain, we talk about the anxiety and depression that tends to come up, and simply because sex isn't talked a lot about. And so this essentially starts to create a safe space for women to begin questioning their beliefs and values and messages that they've had over their time of growing up, for instance, through sexual education, through the media. And again, I'll get to those in a little bit. But some of these questions can be really difficult for women to answer. For instance, how did you learn about sex or sexuality? What was the temperature or the willingness to talk about sex and sexuality or bodies or body functioning as a child? What was it like as a teenager? And how are those messages impacting you today? Are they affecting you in a negative way? Are they affecting you in a positive way? And then if they're not working so well for you, it might be a place, having psychotherapy support or a trusted friend, it might be a really great place to be able to try on different messages, even temporarily, just sort of starting to explore what messages or what beliefs or values are still relevant and still helping the woman with her sex and sexuality and body image, what's working for her today, and then what might be adjusted so that she can feel a little bit less anxious or upset about the ways in which her body might want to naturally respond. In therapy, another way that pain is addressed is by doing cognitive behavioral therapy. And specific techniques of this might be using what's called a pain diary. So a woman might record for a month every day the pain level she's experiencing, and start to notice at what point she might have been overly stressed or what point she's at in her menstrual cycle, and pain level is and what it's affected by. And then as the awareness is created around what might be causing the pain, steps can be taken to change some of those things that are occurring in her day-to-day life. And then continuing to record the pain, the woman can figure out what's affecting her and what she needs to be able to attend to in order to remove that from her life so she doesn't have pain. Also, the pain diaries help by being able to, for the woman to be able to start to identify the messages that have impacted her and the beliefs that she has around sex and sexuality and her pain, and then be able to change those maladaptive thought patterns, so thought patterns that are not working for her, thought patterns that elicit anxiety, that create her to feel nervous about sex and sexuality, to create her the messages that seem to create poor self-esteem, for instance. Those can be adjusted as they're identified, and so that can be done with a psychotherapist as well, or it can be done on her own. A lot of women have found that just simply Googling a pain diary and researching a little bit more herself, she can start to be able to do this on her own. But if a woman is needing help to support that, a cognitive behavioral therapist or a psychotherapist in general, our therapists here are trained in both. So if you call CHS at the number that I wrote in, you can get set up with one of our therapists to help you work through these if that seems like there's more support that's needed. Another thing that's helpful from therapists is learning more about sex education. Our sex education has been very limited to simply what's needed to know in regards to the changing body or the body that's going through puberty, and not specifically addressing bigger issues of sex and sexuality. And typically sex education comes from a shame-based place, it comes from a sex-negative place, and it comes from scare tactics. And so trying to start to loosen up those ideas and create some more room for positive, pleasurable beliefs about sex and sexuality can help encourage more supportive experiences of sex and sexuality, and more pleasurable, more enjoyable, less anxiety-producing beliefs and views around sex and sexuality. And again, this can be done with trusted girlfriends, trusted family members, people that a woman can feel comfortable and safe with, saying, hey, this thing that I thought about sex sort of worked for me and I understand where it came from, but I don't know if it's necessarily the best thing for me anymore, and I'd like to try on or think about things in a different way. What do you think about it? And just opening up those conversations with people that are trusted and safe can be a new experience and can start to open up doors on how to experience their bodies and sex and sexuality. The limbic system is basically the place in our brains that was developed first and essentially is there in order to keep us alive and to help us survive. And what happens is it's run on either emotions or, again, survival tactics. And because that's the case, if our limbic system senses anything being a threat, whether that's an emotional threat or a physical threat, such as pelvic pain or such as a sexual interaction, if that causes any anxiety simply because a woman doesn't have a comfort with her sex or sexuality, her limbic system might go into a state of being shutting down the pleasure centers and just running on survival and being in a sort of fear-based situation. And that's going to significantly decrease the possibility of any sort of arousal and desire, which could then lead to a lack of orgasm or painful penetration or painful sexual experiences physically, as well as emotionally. And so I always say that that anxiety is the opposite of orgasm. So if you can kind of run from that place, then it's very, very obvious that trying to calm down anxiety will lead to orgasm, but also it will lead to just a more pleasurable sexual experience. It will lead to more connection, more intimacy, and just an overall general sense of well-being to start to reduce anxiety. And another aspect of psychotherapy is group therapy. This provides a safe space for women to talk about their issues that they think that they're alone on, and finally they get to have a space of, oh, you too? I thought I was the only one who experienced that or who thought that or had any pain. There's not a lot of information about pelvic pain for women out there, and when they can get together in a group and get the support of other women, they realize that they're not so abnormal or they're not so weird or they're not so alone in their struggle. And having another support in addition to a trusted friend or a trusted health practitioner can be extremely beneficial in opening up the possibility for something more pleasurable, more enjoyable. One of the things I had mentioned is trying to question the messages that have come to women over time. And there's an image on the screen that shows basically media and ads for women that sort of over-sexualizes them and objectifies them. And this is just one example of the different messages that come into women, come on to women that show ways in which it's difficult to be a woman in society because we're told to be a sexual object, but then these ideas of rape culture and slut-shaming come in. So if a woman embraces her sexuality or gives any semblance of having had a sexual experience that isn't in a certain box, then she's shamed for what her experience was. And that can be really confusing and conflicting for women internally, and it might be even operating at a subconscious level. So being able to start to question those beliefs and open up a possibility for other beliefs that feel right to them and to their own personal morals and their own personal moral compass can be a wonderfully eye-opening experience for them to start to decide what messages are important to them and what messages aren't so important. And there are other beliefs that come in and values that come in from family and culture and religion and other friends. And those are extremely important messages. But if they start to create a dissonance between what a woman is experiencing, what she's doing with her body and what she wants to do with her body, and the messages that she's told to do, or the ways in which she's told to act or behave or think, if those aren't lining up, it can be really psychologically difficult to deal with what's going on. And then that's going to increase anxiety significantly and reduce the amount of enjoyable pleasure that she's having with her partner or with herself or potentially even with gynecological exams that can also be affected by that. Another aspect that is that I mentioned earlier is the limbic system. So I want to get a little bit more into that here. And again, I would love to have questions to be able to help answer anything that might be coming up for you as we go through this. So in the limbic system, so it's back here in the stem of the brain, and as you can see on the screen, if you're logged in online, it's kind of deep in the part of the brain, and it's in charge of what is known as the flight or fight system. So again, if the amygdala senses that there's any sort of threat in the environment, this part of the brain is going to kick on, and then it starts a series of messages to the rest of the body and the brain. And what happens is the parts of the body and the brain that are turned on are the parts that are going to keep us alive. So we're going to get blood rushing to our extremities, so our legs and our arms, so that we can either run away or so that we can fight. And then also the systems that are turned off are the things that aren't necessary for staying alive. So that's our digestive system as well as our arousal system, meaning our sexual arousal and desire. And so if these parts of our bodies are turned off, then, like I said, we're not going to be able to have an orgasm or have a pleasurable sexual experience because that part of the body is not encouraged to be turned on at that moment. And I mean turned on I mean activated, as well as physically turned on and feeling the effects that is needed to have a pleasurable sexual experience. And this can occur either at the moment of sexual activity or it can occur hours before even. If a person is feeling anxious about the idea of sex or sexuality or their body, the system and the brain is going to be in this survival mode. So blood won't be flowing to the right parts of the area in order to have the parts of our body that we need stimulated or aroused. And one way to be able to sort of counteract this experience when it's not necessary, so when we're not threatened with our lives and when we're not needing to stay alive in that moment, then one way that we can help our amygdala calm down so that it's only activated when absolutely necessary is to induce what's called a relaxation response. And this isn't an automatic occurrence unlike the flight or fight system. The amygdala is triggered in an automatic way, but the relaxation response is needed to be turned on by practice, and it's something that we have to be intentional about. A recent study came out saying that even doing 21 days of guided meditation can start to change the way that our brains work, as well as how we can start to reduce anxiety and depression. And so the relaxation response is wonderfully activated by doing meditation or mindful awareness. Meditation can be extremely hard if you're just trying to sit down, you've had no formal experience or teachings on it, and just trying to sit down and do it is really difficult because oftentimes we sit there thinking, am I doing this right? I don't know. There are a lot of thoughts in my head, like, oh, what did I do yesterday? And what do I have to do tomorrow? And then suddenly a few minutes have gone by and you realize that you've been in your head in these whirling thoughts, which is actually not a way to meditate, but just trying to be focused on the breath and being aware that this happens and trying to always constantly return to the breath, return to the meditation. But because those thoughts come in very often, it's helpful to be able to have some sort of formal training to be able to help your brain and support your body and your breath and your mind to try and figure out exactly how to work with those thoughts, because they're going to come in. It happens to even the people who have been practicing for 30 plus years. it happens. And the focus is just on returning back to the breath. So some of the ways to be able to get some training on this is by either doing it in psychotherapy with a practitioner who knows how to work with meditation and mindful awareness, or by taking some classes. UCLA, if you're local to Los Angeles, they have a MARC Research Center. It's on Mindful Awareness Research Center, so MARC. They have classes that run all year. And then you can also do them online, too, if you're not local to UCLA or not local to Los Angeles. These classes are absolutely wonderful, and it gives a little bit of the theory as well as the practice of mindfulness and meditation. And then also if you're, you can do this from anywhere. Oprah and Deepak Chopra just did a 21-day meditation experience, and it's available online. So if you just type in or Google this experience, it'll direct you to the meditation experience where you can download it. And it goes hand in hand with the research that I told you about, this 21-day meditation experience. So let's see, we have a question here from San Diego, that if a person has complex PTSD, does it make it difficult to orgasm? And I would say absolutely. PTSD is a very difficult experience to have, especially on the arousal system and the amygdala and the flight or fight system, because it's constantly triggered, especially by very complex PTSD experiences. So I would say this is absolutely something that is often a complication of having PTSD, is the sexual arousal and the emotional arousal often go hand in hand in having a difficult time processing the emotions from having PTSD in real time and trying to have a sexual experience. So it absolutely does. And I think that if somebody is experiencing complex PTSD or any PTSD, that helps best for it if you're a therapist. Let's see. Great question. Thank you. So let's try doing a little mindful awareness or a meditation. I think it's absolutely helpful for everybody to be able to experience it at some point. It can be wonderfully calming to the brain and to the body and the system and the awareness. So why don't you go ahead and we're going to do maybe just a 1-minute exercise. So if you're in a place where you can close your eyes or take a soft gaze, and if you're not, then you can try this at another time. This will be video. This is being recorded, so you can refer to it later. So go ahead and close your eyes, or take a soft gaze. Get grounded in the place that you're sitting. Maybe you're sitting in a chair or on a sofa. Get comfortable in your seat. Really feel your body being supported by the chair, by the sofa. Feel your feet flat on the ground. You wiggle your toes. Find peace in being so supported by the chair or the sofa or the ground. Feel the warmth of your seat radiating against your back and the back of your legs. And take 2 deep breaths in, perhaps through your nose, and maybe blow out your mouth. And let your body sort of sink into the support of the chair, the sofa. Then return to your normal breath. As you do, notice how your breath comes in through your nostrils or your mouth. Notice the quality of your breath. Does it tingle? Does it tickle? Make your mouth dry, perhaps the back of your throat dry. Notice these things as you're breathing in Notice the quality of the breath as you breathe out. Curious about it. Feel differently than when you breathe in. Feel the same. There might be thoughts that come into your head. And simply notice them without judgment. When you notice them, just bring your focus back to your breath. You might notice sounds. Again, just simply notice them. Distractions will come in. You can gently thank them for coming and ask them to leave just for a moment. And then returning back to your breath. Breathing in and out. Focusing on the quality of the breath. And then when you are ready, you can open your eyes. So I'm curious how that was. And again, that was slightly sped up simply because of the nature of this. But I'd like to hear your thoughts or read your thoughts, I guess, on how that was for you. Was there anything that you experienced? Was it hard to stay focused and present? And you can actually even unmute yourself by pressing #6. And, you can chime in, let us know what you were thinking. Give a moment here for that. Someone from Seattle said that they were surprised at how much anxiety that they were holding. Somebody else said, it took away some of my physical pain that I'm experiencing today. And this is great, this mention from somebody in Seattle. Simply bringing about the awareness of the anxiety that you're holding can help you start to realize when your body is holding that anxiety. And it's a good practice to even go throughout your day, setting a reminder on your phone even, maybe every half hour. Just an alarm on the phone to stop and take 10 breaths, sort of like a shortened version of what we did today. Just taking 10 breaths of noticing the quality of the breath as it comes in and as it comes out. And that can help you start to pinpoint exactly where the stress and anxiety and tension is in your body, and you can relax that part of your body for that moment. Bringing about awareness will bring you more into your body so that you're able to tolerate the everyday random little stresses that we experience, which will in turn allow that to transfer over to any sort of pelvic pain that you might be experiencing, or any sort of other pain in your back or your knee or your shoulder, or just regulating your emotions much better will help reduce the amount of pain that you're experiencing and feeling. Being able to do this throughout your day makes it so that it's less of a difficulty to practice in the moment when having to have a gynecological exam or insert a tampon or have sex with your partner or use a sex toy with your partner. Being able to recall on the experiences and the practice that you've had, if you do it throughout the day or daily, then it will be less of a chore to do it in the moment. So it's sort of like being able to have a tool in your toolbox that you can pull out at any moment and then using it at that moment. But you can't really be able to do that if you don't know how to use that tool in that moment, if you don't practice every day with it.
It was very nice to have your voice reassurance. I'm in Vancouver and just found having you walk us through that exercise is kind of a good way to be able to recall that experience for future times.
Excellent. Thank you. And that is definitely the benefit of doing a guided meditation. When you do it on your own, it's a little bit easier to get sort of distracted on what your intention is behind the meditation. So having somebody else's voice in to remind you hey, remember we're trying to meditate, and that's okay that you got a little distracted, but come back to me, come back to my voice. So I'm really glad to hear that that was something that you experienced. Somebody else said that also they would space out, and then even the voice, even hearing my voice wasn't enough to keep it present. And that's another thing that happens often to people who are practicing meditation, is it's very easy to simply space out. And that's completely natural. Being able to have a formal experience with somebody to bounce your ideas off of and say, hey, this is what I experience, and for them to say, yeah, that's completely normal, that happens to me too, it makes it easier to not judge those thoughts so much anymore, or to lessen the amount of judgment that's on the intruding thoughts. Because oftentimes people being very task-oriented want to create to-do lists, and it's very easy when you have a moment to stop and think about the to-do list, it's very easy for those to-do lists to pop up that you don't even hear or notice the surroundings. So being able to know that that's something that other people do as well helps make it easier to enjoy the practice. And I mean, that's sort of what everything's about, is do something when it's enjoyable, and then that will increase the benefit of life in general. Somebody here from Nebraska says that he teaches stress management, and this is the first application of it related to sex and sexuality. And a lot of the stress management and pain management ideas and research has been used to work on sexual pain issues. And so a lot of the pain management that has been done, although hasn't been specifically tailored to sexual pain as frequently or as much as what has been done for back pain or chronic pain, it's now becoming a lot more commonly used in psychotherapeutic practices or pelvic floor practices in how to address sexual pain as well. And the same thing, again, goes for stress management, that reducing the stress a woman feels is going, and men as well who are having sexual functioning issues, being able to reduce stress management, sexual function is going to go way up as when stress goes down and when anxiety goes down. Thank you for that comment. I hope that it starts to become a lot more common. One of the things that I've found extremely beneficial in working with the women that I treat for these issues, and just in general, my friends and I love talking about this idea of female empowerment and personal empowerment, and it's very rewarding. It's very life rewarding to be able to feel empowered as we move throughout the day. And when a person feels empowered, they feel a lot more confident in the ways that they're interacting with people, with partners, with themselves when it comes to sexual interactions. And then also interacting with health practitioners, being able to feel empowered to say to the expert, doctor, I'm feeling this, and I know that we've talked about it before in the past, but I still am concerned about it, and I'm wondering if there's something else that we might be able to try, to just feel empowered to simply assert themselves in these situations can help reduce the anxiety that they have around this issue. One way that this has been done that I've seen is through group therapy. As I talked about, this idea of, you too, it suddenly feels less shameful, and women start to feel a lot more supported and empowered to be able to talk about these things that they previously wanted to avoid discussing. And then instead of this pain or this anorgasmia having control over themselves and how they feel about themselves and having control over their sex lives, women start to take the control back and say, and are able to say, you know what, pain, today, I'm empowered today, and I don't want you to control what I'm experiencing. I want to be able to take some control over this. And to give an attempt, and sometimes it will be successful, and sometimes it won't be, but to be able to start making those steps toward empowerment. Another way that this is done is by reading books that are female-centric or written by females. Some really great books I've put up here on the slide, but it's For Yourself by Lonnie Barback. And this is for women who are having difficulty orgasming, but it can also be for partners, and it's just a really great female empowerment book to sort of embrace sex and sexuality, start to question the things that aren't working for them, and opening up ways in which to understand and see sex and sexuality as an empowering thing rather than a shameful thing or a fear-based thing. Another book that I love is Tantric Sex for Women, a guide for lesbian, bi, hetero, and solo lovers by Christina Schulte. I hope I pronounced that correctly. She is a tantric teacher as well as a psychotherapist, and this book has very applicable and practical applications of ways in which a woman can get more in her body, feel a lot more comfortable in her body, and experience breathing, her body, and sexual actions or activities in ways that is anxiety reducing and also empowering. Again, I had mentioned tantric teachings because a lot of people have a misconception that it's just about sex and interacting with another partner, and really it's about embracing this female sexuality from a place of enlightenment and positivity. And being able to do this can help enhance a woman's experience of how she moves about in the world and every day and the interactions with other people, not on a sexual level, but just in a loving, caring, open-hearted level that comes from a place of feeling comfortable in her own body. So Tantra really helps women tap into that while also addressing the sexual components. Another absolute necessary aspect of working on any sort of psychological stress or concern is to exercise for health and strength rather than trying to figure out, trying to get to a certain size or a certain weight. And so exercising for the empowerment is brought on by exercising for health and strength. And yoga classes from a male or female who embraces the idea of female empowerment in the practice, so really honoring the goddess and honoring this sensuality and connection to mind, body, and spirit can be wonderfully helpful for women to experience exercise, which is good for health, obviously, and then also the mind, so exercising the mind and exercising sensuality as well, and being able to be connected that way. So I think that those are some really great places to be able to focus on the personal empowerment, in particular female empowerment. So I'm going to bring up the slide that has my contact information. And we have about 5 minutes left, so I really would like to open it up to any sort of lingering questions, things that I wasn't able to touch on that you were hoping I would get to. And while we're doing that, while I'm waiting for questions to come in, I'd like to talk a little bit about the sex therapy issues that we see here at Center for Healthy Sex. So we work with male and female clients as well as couples who are struggling with any sort of sexual functioning issues. And a lot of people will call these sexual dysfunctions, but coming from a place of empowerment and also from a sex positivity viewpoint, we like to say that it's a sexual function issue or a sexual difficulty, simply because the idea of a dysfunction feels like it carries a weight of negativity to it. And so simply changing the language around these issues can start to loosen up the idea of somebody experiencing these issues rather than feeling stigmatized by being somebody with a dysfunction, and really just talking about it as a challenge that can be overcome. We believe and we see that our clients are much more embraced by this idea, are much more supported, and can then get to a level of functioning that they're happy with. Being able to support them in this way allows for new spaces in the room to talk about sex and sexuality because it's not a shameful experience. Our sexual desires, as long as they are consensual and as long as it's not imposing on anybody else, we believe that a lot of sexual behaviors are completely natural. And simply talking about sexual desires and comfort, or talking about sexual desires can create more comfort around these sexual issues.
I like the idea I thought of it when you were talking about the pain diary, starting to talk about it perhaps as a comfort diary.
So I like that a lot.
Yeah,
I like that a lot. Someone had suggested talking about, instead of pain diaries, comfort diaries. And I was actually working with a yogi and an acupuncturist, and she was talking about having a magical, instead of using a painful feeling that she has in her body physically, but rather talking about it as a magical experience that she's having in her body. So in the beginning of the yoga class, she talked about, okay, so let's all identify any place that we're experiencing any particular magic that we'd like to send our energy to today, and something to be aware of, that there's some magic going on in that area. And so people talked about, I'm experiencing some magic in my lower back, and I'm hoping to stretch it out in this certain way. So that you're right, changing the language even that way. I have a message here that says that somebody tends to avoid sexual contact with partners due to anxiety, and then partners will then back off as a result of feeling that. This person says that at the same time, I know that I want to try and have sex. So how do you balance when you are too anxious to have sex and when you should try to get beyond it in the moment to have sex? Because it feels like if I waited until I wanted to have sex, it might not ever happen. This is a constant struggle that people have when they have anxiety around sex and sexuality, for men and women alike. And it's really hard to figure out at what point how are you supposed to work with this? It's sort of like a chicken or egg situation or issue. And this is one of the experiences that would be really helpful to talk about with a therapist who's trained in practice in addressing the sexual avoidance or the sexual anxiety, because they can really specifically tailor to your experience of what you might be able to do to help calm the anxiety, either in the moment or over a daily practice of stress reduction or anxiety reduction, and then start to manage or tailor what it is that you are experiencing, and see what the effects are of the stress reduction, whether it's in the moment or over a practice of time. So I hope that answers that question, and if you need further help or support with that, please feel free to call Center for Healthy Sex. The number is on the screen, but 310-843-9902. And you can email me again at Kayna, that's Kayna, at centerforhealthysex.com. Thank you so much for your insight and your questions, and for being here and being present. I appreciate it. And please join us for the future Sex Experts web series. Take care and have a very wonderful day.